Well, in the immediate aftermath of the explosion, thousands of injured people streamed to Beirut hospitals, which, of course, had been operating within the context of a global COVID-19 pandemic. Right now, we are reaching out to one of the doctors who is on the front lines of that response in Beirut. Dr. Fred Bteich is a neurosurgeon resident at Hôtel-Dieu in Beirut. So, Doctor, thank you for joining us today.
Thank you, Michael. Good afternoon.
Good afternoon. You know, I'm hoping that we can begin on the day of the explosion on Tuesday. Describe for us the scenes that you experienced in the aftermath of what happened in Beirut.
Well, I mean, no matter how much I will describe the scenes, how much you've seen in pictures and in videos, it doesn't give reality justice. Because what we've seen on the ground, at the hospitals, on the streets, is far more catastrophic and apocalyptic than one could imagine. I mean, in my field of work at the hospital, patients were piled up on the floors, on desks. There was blood everywhere. So many injured people. We could barely do some triage. And with this COVID pandemic, conditions were horrible to work in, so we had to manage as much as possible, and the ER was a total mess, receiving around more than 1,000 patients, and the OR as well. We had some urgent surgeries, some of which were very severe, but we had to do what we had to do. We had quite a few sleepless nights. With a lot of stress, a lot of emotional stress, physical stress, and sometimes it would go well, and sometimes it would go very badly.
Yeah, we're going to talk a bit more about that, but I want to go back to you mentioned COVID-19. This is happening in the midst of a pandemic, and I'm hoping you could paint a picture for people at home, because, hospital resources across North America have been challenged with COVID-19, but here you are in Lebanon, a country that is economically challenged, that the healthcare system was not even up to where doctors would like it to be ahead of the pandemic, and then this explosion. Can you talk to us a bit more about the resources and how stretched they were when you added this explosion to the COVID-19 pandemic that's happening on the ground?
Well, this was very problematic, we know, because normally, for example, for patients we would operate on, normally they would get tested before we go into the OR, but in these conditions, no tests could be done, of course. We would just take our precautions as much as possible with the means of precautions we have for COVID-19. I'm lucky that I'm part of a big hospital in the country where we were quite ready for that. Of course, not ready for such disasters, but well equipped at least. And we would just cross fingers that the patients we're treating were not infected and would not transmit the disease to us, and just do what we had to do.
Mm-hmm. Do what you have to do, and I also know that you tried very hard to save one patient in particular, and I'm talking about a 3-year-old girl that you discussed on social media. I know it may be difficult, but I'm hoping you might share with us that story.
That little girl, that little angel was 3 years old, and she was among those patients who suffered severe injuries and came to us right after the explosion happened. We tried our best to resuscitate her, to help her. We performed surgery on her, but unfortunately, her body succumbed to her injuries, and she passed away in the upcoming hours. So this was a very touching story, because, some people are talking about, are describing them as martyrs. I don't see them as martyrs. I see them as victims of corruption, victims of this government that has failed throughout the years to help its people, to come to our basic needs, and just to help us live a life that is well, I don't know, that can be lived. Because what we've been living for the past 9 months now, with a financial crisis, with a pandemic, a health crisis, and now this explosion, it all adds up, and it's just like a political advisor. I saw an interview with her on CNN, Sarah El-Yafi. I'm going to quote her. She said, "It's like you're in a horror movie, and you're writing a script, and you give it to the director, and even the director would tell you, please tone it down a bit, because this is unimaginable. This is how severe the case is here right now."
I'm going to ask you to connect the dots, because I feel that Canadians may have heard many times now, several times now, people in Lebanon saying how they believe this is the government's fault, that this is tied to government actions. Would you mind connecting the dots for people here in Canada? How is the government responsible for what we have seen here?
In fact, it's the government's fault, because we elected them a few years back, and a few months back, not to go far away from now, and we expected them to deliver, just to give us our basic rights. They promised so many things on different sectors, in the health sector, in the political sector, in everything, and we just saw unfulfilled promises, and the economy collapsed. They couldn't sustain it. Everything. Not a sector is working perfectly in the country, and in fact, you could blame also the people, because they elected them. But right now, if you would do elections again, I don't think at least a part of those who elected those leaders have changed their minds, because this explosion has rocked them, and whether they have lost lives, they've lost houses, they've lost friends. Some people have lost literally everything, so it doesn't matter to them anymore what this government is doing. They just want somebody who listens to them and who gives them their basic rights.
Mm-hmm. You know, Dr. Bteich, before we go, I wonder what you hope will come of this. Today, the international community did take part in a virtual summit, many countries promising aid, Canada promising to match individual Canadian donations to send to humanitarian groups on the ground trying to help people in Beirut and in Lebanon. What do you hope comes out of this? You, a doctor who has to look at a 3-year-old girl die in your arms, how do you carry on? What do you hope comes out of all of this?
Well, listen, we rely on this international help a lot, because we know that our government and our country cannot sustain on its own this ongoing crisis, mostly because of this financial crisis we're going through. So every single fundraise, every single medical equipment, and every single logistic that could help with the victims, with their houses, rebuild their houses, and the rescue missions. So, I mean, any help is welcome at the moment. Any help is welcome.
Dr. Bteich, I want to thank you for the time.
Thank you very much.
And Dr. Fred Bteich is a neurosurgeon in Beirut.